Now on to the cestodes, our segmented flatworms, which are all transmitted by ingestion. Tania solium, or the pork tapeworm, is one helminth that can present as two different diseases depending on whether the egg form or the larva form was ingested. Ingestion of the larval form from contaminated pork leads to an infection characterized by intestinal colonization by the adult tapeworm, which you can see here, and it also leads to mild gastrointestinal symptoms. Ingestion of the egg form through fecal-oral contamination causes a much more serious disease known as cysticercosis. In this situation, the egg form hatches in the intestines, allowing the larval form to then penetrate the intestines, enter the bloodstream, and affect any tissue. Neurocysticercosis is diagnosed when the larval form has penetrated the brain or spinal cord, and you can see multiple cysts within the brain. And what common symptom might be described in your board question? Seizures. Treat with praziquantel or albendazole for neurocysticercosis. The next cestode is Diphyllobothrium latum, which is ingested in undercooked or pickled freshwater fish. We spent a little bit of time integrating some serious hematology a few slides back, and I want you to tuck this little guy away with those notes, because there is a vitamin deficiency that's caused by Diphyllobothrium latum. Can you remember it? B12 deficiency. And what kind of anemia did we say resulted from B12 deficiency? Macrocytic anemia, and MCV greater than 100. Excellent. This long worm seen here, which can grow to be several meters long, can attach itself to the intestinal wall and compete with hosts for nutrients, especially vitamin B12. As a result, the host will become vitamin B12 deficient and present with megaloblastic macrocytic anemia. Treat with praziquantel. The last of the cestodes is Echinococcus granulosus, which is contracted by ingestion of eggs from canine feces. Larvae hatch in the GI tract, and like all other ones that we've talked about, they penetrate the intestinal wall and migrate to target tissues, a very common mechanism. But this one is especially likely to go to the liver, where they form hydatid cysts. These liver cysts can present as right upper quadrant pain and hepatomegaly. Diagnosis is made by seeing the cysts in tissues on X-ray or CT. Can you remember the description of the cysts seen on imaging? They're classically described as having eggshell calcifications, which you can see here. So here's your cyst, and that thin rim of white, that's your eggshell calcification. So I'm going to erase that so you can see it one more time. Cyst, eggshell calcification. Here's an image of a typical cyst at removal. Surgeons must be very careful when attempting to remove these cysts. Rupturing them can release Echinococcus antigens into the blood and cause severe anaphylaxis. Therefore, your surgeon will inject ethanol into the cyst before disturbing it in order to kill all the Echinococcus daughter cells. You're going to treat this one with albendazole. Flash quiz. A 34-year-old Mexican immigrant presents with a recent onset of seizures. CT of the head reveals multiple cystic structures throughout the brain. What is the most likely diagnosis? Neurocysticercosis, which is caused by Tania solium. Now on to the two trematodes, both of which can be treated with praziquantel. Remember, trematodes are non-segmented flatworms. They have complex life cycles that involve snails as intermediate hosts. First are the schistosoma species, whose eggs are released into fresh water. The eggs then go through two intermediate forms which can penetrate through human skin. The one you'll most likely see is schistosoma hematobium, which can lead to squamous cell carcinoma of the bladder, and this presents with painless hematuria. Schistosoma japonicum and mansoni cause granulomas and fibrosis. Remember these buzzword associations. Portal hypertension is associated with schistosoma mansoni and schistosoma japonicum. Schistosoma hematobium, which has heme in the name, is associated with hematuria and can cause squamous cell bladder cancer. Finally, Clonorchis sinensis, which is endemic to Southeast Asia. Larvae are ingested in raw or undercooked freshwater fish. The larvae migrate through the GI tract and mature into the biliary tree. A common mnemonic that may help you remember this is that Clonorchis climbs into the biliary tree. Inflammation of the biliary system can lead to pigmented gallstones, which you can see here. What cancer is associated with Clonorchis infection? Well, if it affects the biliary tree, then it makes sense that it would cause cancer of the biliary system. Do you remember what that's called? It's called cholangiocarcinoma. Remember the buzzword associations among biliary tract disease: cholangiocarcinoma and clonorchis. As we've gone over each of the worms, I've tried to highlight certain buzzwords that you should remember in association with each one. As a final exercise, let's review them quickly to really solidify these key points. First buzzword is cholangiocarcinoma. What parasite comes to mind? Clonorchis sinensis. Remember, it invades the biliary tree. Next, how about seizures and brain cysts on CT scan? Answer, Tinea solium, which causes cysticercosis and neurocysticercosis. Okay, let's keep moving. Painless hematuria. What are you thinking? Schistosoma hematobium, which causes squamous cell carcinoma of the bladder. How about eggshell calcifications and liver cysts on CT? This should make you think Echinococcus granulosus. Great. Next buzzword is microcytic anemia. What two nematodes are you thinking? Ankylostoma and Necator, the hookworms which latch onto the intestinal mucosa. Okay, so now your patient has myalgias and periorbital edema after eating barbecue. Think Trichinella spiralis. How about a child with perianal pruritus? Remember your Scotch tape test for Enterobius vermicularis. Portal hypertension? This would be the two other schistosoma species, Mansoni and Japonicum. Finally, vitamin B12 deficiency. Impress your medicine attendings by dropping some serious knowledge on them when you say Diphyllobothrium latum. If you master this list, you'll be ready for the parasite section of your boards. Identify the organism seen in this micrograph. This is Entamoeba histolytica, which you can identify because of the red blood cells which are trapped inside. Remember, this causes a bloody diarrhea, and there's your RBCs. Okay, so we have reached the end of my lecture series. To help you review some of the key points we covered, I've pulled a few representative questions to go over with you. These are very similar to questions that you will see on your actual Step 1, so get ready. Infection with Malassezia furfur causes a skin hypopigmentation. It is found most frequently in hot, humid tropical regions. It is also responsible for causing one of the cutaneous mycoses. Infection with Malassezia furfur causes which of the following disorders? A. Tinea capitis. B. Tinea cruris. C. Tinea nigra. D. Tinea pedis. Or E. Tinea versicolor. Take a second to think about this one. Okay, time is up. Let's go over the answer. So here's a straight recall question. We want you to match the disease with the organism. So Malassezia furfur causes Tinea versicolor. Excellent job for those of you that got it right. For those of you that didn't, let's go over it and figure out what you missed. Symptoms of Malassezia furfur causing Tinea versicolor include hypopigmented skin lesions that occur in the hot and humid conditions. A potassium hydroxide test will demonstrate the characteristic spores with short mycelium referred to as the spaghetti and meatballs appearance of Tinea versicolor. Malassezia furfur is treated with topical miconazole or selenium sulfide, and empiric therapy is usually attempted before formal workup is completed. Tinea capitis is usually caused by Microsporum canis. Tinea cruris, also known as jock itch, is commonly caused by Epidermophyton flocosum and Trichophyton rubrum. Tinea nigra is a superficial infection of the stratum corneum. It is usually acquired through direct contact with soil, wood, and decaying vegetation. Tinea pedis and Tinea unguium is almost always caused by Trichophyton. These are infections of the foot and nail. Next question. A 10-year-old girl living in New Jersey is brought to the physician because she has had a fever and headache accompanied by vomiting and bloody diarrhea over the last few days. She has no history of recent travel or sick contacts, but has a pet puppy, which the mother says has also had diarrhea for the past week. A stool culture is incubated at 42 degrees Celsius in a microaerophilic environment, and it shows many gram-negative comma-shaped organisms, each with a single polar flagellum. The organism responsible for this patient's sickness is associated with the possible development of which of the following symptoms? Is it A, acute renal failure and thrombocytopenia with hemolytic anemia? B, fever, migratory polyarthritis, and carditis? C, fever, new murmur, small erythematous lesions on the palms, and splinter hemorrhages on the nail bed? D, petechial rash and bilateral hemorrhage into the adrenal glands? E, symmetric ascending muscle weakness beginning in the distal lower extremities? Okay, so this question is asking us not only to identify the organism by the description, but then to go one step further and give the symptoms of another disease process associated with the same organism. So what is the organism described here? Remember when we talked about organisms that grow at 42 degrees? That's hot, right? Hot like campfire even. Remember Campylobacter? It grows at 42 degrees Celsius. Guillain-Barré syndrome is characterized by rapidly progressing ascending paralysis. It is an autoimmune-mediated illness that can occur following a variety of infectious disease, but is particularly associated with prior infection by Campylobacter jejuni. Campylobacter jejuni gastroenteritis is characterized in this patient by her GI symptoms as well as the presence of comma-shaped organisms with polar flagella. So there are a few hints in the actual question. Now let's go over some of the other answer choices. Hemolytic uremic syndrome, or HUS, is characterized by acute renal failure, thrombocytopenia, and hemolytic anemia. HUS can be a complication of an infection caused by E. coli O157H7. This is a gram-negative rod that can cause enteritis. Rheumatic fever is characterized by fever, migratory polyarthritis, and carditis. It is known to occur after group A streptococcal pharyngitis. There is no evidence of strep pyogenes infection in this patient. Now, a fever, new murmur, and Janeway lesions are signs of bacterial endocarditis, most often caused by Staph aureus. Okay, so these two questions are very typical and representative questions of the type of microbiology questions you might see on your USMLE Step 1. I've tried to go through the answer choices for you in a systematic way to help illustrate for you how I think about the questions. Everybody's going to have their own strategy. I encourage you to practice these questions in different ways as you're studying. Remember to use the question banks as a tool, almost as a textbook, and learn from these answer choices, not just the one for the correct answer, but also from the other incorrect answer choices, as those also contain valuable information. Good luck on your studying and keep up the good work.